The vaccine for kids is actually a smaller dosage than the vaccine for adults. It's the vaccine for kids contains only 10 micrograms of the antigen ingredient, whereas the adult or over 12 vaccine contains 30 micrograms. When they did the clinical trials and when we were observing kind of the rollout in other places like the US, there have been some certainly mild side effects. So if we think about side effects to right to where the arm is, where the injection goes in, sore arm, perhaps a bit of redness, sometimes warmth in that area that typically settles after a couple of days. And then if we think about whole body side effects that we sometimes get with other vaccines as well, such as a fever, body aches, feeling tired. But what they have found, and potentially related to it being a slightly smaller dose, is that the side effects don't seem to be as severe as with adults. And to this date in the clinical trial data, there had not been any severe side effects that had been noted. In the clinical trial data, there was no cases of severe allergic reactions. In the rollout so far in the United States, I think there have been some smaller reactions, but no significant like anaphylactic reactions. Our advice for kids with a history of allergies is similar to adults. So at this point in time, the only allergens that we'd be worried about is if they were allergic to a specific component in the vaccine. So an allergy to nuts would not be a reason to be concerned that you'll have a reaction to this vaccine. That being said, anyone that does have a history of severe allergies to any other really agent, whether it's nuts or other food or medication, we always monitor a little bit longer at the clinic as an extra precaution. But there certainly doesn't seem to be any evidence or association that a nut allergy makes somebody at higher risk of an allergy to COVID vaccine. And it's actually often through social media that we're seeing this. You might see a post and then it's reshared repeatedly, and it's hard to really determine what the source was or where that information was. I can confirm that parental, guardian, caregiver consent will be obtained for any vaccinations for 5 to 11-year-olds. I can confirm that there are no microchips in the vaccinations. There is no evidence and actually no kind of biological reason that it could happen that the vaccine would affect your DNA and change it in any way. I'm trying to remember the last one that you mentioned.
I believe it was magical properties, but I have also heard from people that they're concerned about potential reproductive issues for their kids.
Right. Yeah. So the properties, I think if we go back to some of the science, what we know about the vaccine, the mRNA component of the vaccine, which is what gets it's essentially the recipe to make a protein, which is going to get your immune system to respond and build antibodies. It doesn't stay in the body for long. There's no, again, biological reason to think or hypothesis to think how it would affect long-term fertility, reproductive organs. Certainly in the adult population, those concerns have not been demonstrated. In fact, the implications in serious disease among women that are pregnant that actually get COVID-19 are much more than any theoretical concerns related to the vaccine. So I think, the biggest thing I think is really to go to trusted sources of information and look beyond social media for some of this information. Resources like Public Health Ontario, Health Canada, Public Health Agency of Canada, our website, other Hospital for Sick Children in Toronto, or the Children's Hospital of Eastern Ontario, your healthcare provider. Lots of really good resources available for parents.